Don't get scared from what I'm gonna say. I had to rethink if this is the right career for me. Carpal tunnel. I would not take a job that's offering me less than $40 an hour. I was a new grad getting $50 an hour. This is so good. People ask me why I'm going for my bachelor's or like what the difference is between associates and bachelor's. Hey everyone, welcome back to my channel. Today's gonna be an interesting video, but a good one because I've been working, a little over 3 months now. I wanted to update you guys on my experience as a new grad and also give you like advice and tips on how to navigate after graduating from hygiene school. I wanted this video to be like a sit down chit chat, but also I thought about I feel like sit down chit chats are a little bit boring. Not boring necessarily, like it's not as engaging. So I'm gonna be not sitting down. I'm gonna be doing some activity while talking to you guys. I'm actually gonna make some overnight oats, and I received a package from my dentist. I hope I'm not showing like that, but I received a package of instruments from my dentist, and I'll be talking to you guys about what instruments I like using now. I don't use every instrument that obviously school taught us to because you have preference, I have to open each one of them up and separate them into like clusters so that I know or kits I should say, and then I have to put these bands on them because each hygienist has a color, and unfortunately they don't have purple anymore because someone else got purple, but it's fine. I had the blue one instead. It's gonna be kind of a long video. It's usually how it is every time I do like a sit down video, so at least this time it's not sitting down. By the way, I am back in my dad's house, as you guys can tell. Very nostalgic. I'm using his kitchen because he's at work, and what better way to record a video when you're home alone so that you don't feel awkward if someone's home with you. Alright, so let's actually get started on the video. When I first started, I had to rethink if this is the right career for me, to be honest. So I don't want to sugarcoat anything, but I also don't want to scare you guys, because now that I'm working, I'm kind of used to it. I love what I do, so don't get scared from what I'm gonna say. I wrote some notes on my phone just so I cover everything that I wanted to tell you guys. So the office that I'm working for right now is actually a private office. Technically it's kind of complicated because even a month ago, I think just a couple weeks ago, we partnered up with an actual company. I think it's called DSO, or a DSO type of office. We used to be private. It was owned by a couple. The wife was a HR and the husband was a dentist, and they ran that business for over 20 years. So it's been a long time, and also running a dental office is not easy, especially because with insurance and stuff like that. So I understand why they wanted a little bit of help from someone. So because the wife is there every single day, and I feel bad. She has kids, I want to spend time with my kids too. How I ended up getting the job was because I used to be a server for a family restaurant, and that owner of the restaurant had a dentist that she was kind of close with, which is where I'm working now. They recommended me, so it's basically I got the job through connection. Hygiene is such in high demand right now because especially after the pandemic, a lot of old hygienists are retiring, especially during the pandemic. I think majority of the hygienists have retired. You can be a hygienist really anywhere at this point. I really love this office just because the dentist and both the wife and the husband are very, very caring, and they really care about their employees, especially their patients. There's a lot of offices that are much more money hungry, not necessarily money hungry or they don't care about patients. I mean, there are obviously dentists that are like that, unfortunately, and that's the dentists you wouldn't want to work for. There's the corporates where it's your salary is based off commission, production driven. I don't really see myself working somewhere there because I want to focus more on patient care, not really, I actually started work earlier than when I was supposed to be expected, because I was supposed to start in July, but I started in June because one of the coworker hygienists I work for went into labor, so she started her maternity leave early. And instead of having a temp, why not just start, because I already had my license. I actually ended up getting my license in like 2 weeks. Usually like people wait a little longer than that, because especially with COVID and everything, like everything has been so like delayed. But I was surprised at how quick I got my license. My first day at the job is actually, it was only like a 1-day notice. So it's very, very normal to feel, nervous and anxious about starting your first day, just because like you don't have a professor or an instructor right next to you like telling you whether you're doing okay. You know what I mean? They're like your security blanket. Is that the term? One thing I want everyone to know who's a new grad is don't expect to know everything, and don't expect to not mess up at all, because let me tell you, I've messed up quite a bit. Not like to the point where I'm like putting the patient in danger, kind of like minor things, but it's all in a like learning experience. I think every professional healthcare goes through it, because even though we went to school and yeah, we have the knowledge fresh in our minds, doesn't mean that we have to know everything. I feel like the only way for you to know these type of things is through experience from the real world. I used to get down on myself. I cried probably the first 2 weeks of working because I felt so stupid. I felt like I couldn't be, like, I felt like a bad hygienist almost, because I was like, how come I never like knew about this, or I did know about it, but I've never experienced it during school. That's one thing, you're not going to experience everything in school. You're like more in the real world than school. You have all these competencies at school, and it's like that's not even everything that you will see in your chair. I was crying as well because the dentist was like telling me like, you can't do that, you have to do it this way. Some dentists do have a like preference on how like you should be doing things, which I totally get, and I mean, you work for them, so you kind of have to like cater the way they want it, because their practice, their office. You also have to be an advocate. If you think that that's not the way you should be doing, obviously like speak up. You did go to school for a reason. It's not just all about like, like if you really think that that patient doesn't need this, or this patient really needs this, then speak up about it. Kind of be persistent on like, this patient really needs this. You'll know that in every office there's dentists who kind of have like a preference, or there's some dentists who kind of let you do your own thing. My dentist kind of like does both. He has a preference, but he also likes to do certain things like in a certain way. One thing I highly recommend is trying to shadow a hygienist during your school. I don't know if every school needs volunteer hours. Every semester we needed like a certain amount of volunteer hours. The way I would volunteer was they allowed me to shadow. I always shadowed the one that the one I'll be working for, and in a way it's kind of like my orientation. But there's also this thing called working interviews. So once you graduate, you can start having working interviews, but make sure you get paid for them. Just because you're a new grad doesn't mean like they should take advantage of you, and you will notice that there's going to be people who take advantage of you. Very careful. Make sure that you're being treated well, and if you feel like in your gut that you're supposed to be, receiving this, or supposed to be having this, not having this type of treatment, having a bad feeling or feeling like, miserable, then that's not a good office for you. And like I said, it's hygiene. Our hygienist has such high demand right now. You could basically work anywhere, so don't settle.
Do not settle.
I highly recommend shadowing hygienists before you graduate, or give you a little bit more confidence in starting on your first day. Because if I hadn't done that, I think that I would be way more anxious and scared starting on my first day. Like I said, I did cry. I had moments where I felt like I was a bad hygienist. But now that I think about it, it's like they're telling you things that are supposed to make you become a better hygienist. Not that you're a bad hygienist, but there's always room for improvement, right? And it's not necessarily something to take personally. It's just, giving you more experience. And I don't know if I mentioned to you guys, but I actually in school because I want to get my bachelor's degree for hygiene. Some people ask me why I'm going for my bachelor's or like what the difference is between associates and bachelor's. So with associates, you can basically work as a registered dental hygienist in a like clinic setting. So like as a clinician, you're gonna be just chair side mainly. You can have like other positions such as like working for a company like like Crest or Oral-B, Sonicare. I'm pretty sure most companies might want to higher education, because with bachelor's you do a lot of research. I do love being chairside, I love working in a clinic setting, but I'm getting my bachelor's as a backup because I don't know if I want to be in chair. Like, what if I change my mind 10 years from now and I say that I actually want to work for a company and I don't, like as a sales rep or like management or something like that, or even research. Like, I just want to have like a backup plan. Also, God forbid I get carpal tunnel, get any type of injury, like being chairside, at least I can work, now that more companies working remotely. If I'm injured, at least I can have a backup plan that I don't have to use more of my physical strength. If I was injured, I can't really work anymore chairside. I do recommend it just in case. You never know. With nursing, they tend to get you don't get paid more having a bachelor's with hygiene, but who knows? Maybe it'll change, because you know how with nursing, if you have an associate, you can be a registered nurse, but having a bachelor's will, they prefer it more and they pay you more with it. So you never know, because dentistry is always changing, just with everything else, like with healthcare. While I'm young, I don't have kids, and I'm not, might as well just get the degree now than later where it's going to be more difficult for me. I also want to tell you guys about my second day of my work, because I will never forget this. They gave me my first SRP patient and I was freaking out. If you know, because I had to give an IA block right away on my second day of working there. I was really scared, but it actually went by like smoother than it was when I did it in school. I feel like having a professor or like someone just watching you, like breathing over your shoulder, gives you more makes you more tense. So it's not like I don't really feel that nervous anymore that I used to feel, or the anxiety. But always make sure to review the medical history. You know how it is, like with RDH and their liver. If they have liver disease, obviously you stay away from RDH. Just make sure you always ask them about their medical history. I know there's some patients who's like, I'm just getting my teeth cleaned. Why do I need to tell you what type of disease or medications I have? But little do they know, oral disease is linked with systemic diseases, and I feel like that's also one thing that I want, that I wish more hygienists, especially people with diabetes. My family has a history of diabetes. I highly recommend educating your patients on oral disease and how it's linked to systemic diseases, because if your oral disease progress, so does your systemic disease, and vice versa, and all that stuff. And speaking of that, one advice that the hygienist I shadowed, try to practice everything you learned from school. Try not to forget so much of it, because obviously in the real world you're not as thorough as you are in school, because those patients are in your chair at school for 3 hours as compared to just having them there 45 to an hour, in your chair. You can't do everything, so obviously some of the things you kind of skip and stuff, but try not to forget what you learned in school. Try to bring it with you in the real world, if that makes sense. I was debating whether to talk about salary, or how much I make, but then again I thought about it, I'm like, it's actually really a good thing that I tell you guys, because there's some offices where they'll pay you less than an assistant, and because you're a new grad, new grads tend to be more desperate for a job, but like I said, hygiene is such in high demand right now that do not settle for less. I'm not going to tell you guys exactly how much I make, but let's just say in the 40s range as a new grad. If I were you, one of the rules I did was I would not take a job that's offering me less than $40 an hour. That was like my minimum. 38 even is pushing it a little bit. It's really up to you. I have a friend who was working for 2 offices, and one office wanted her to be a full-time at that office. Like, they were very, very desperate for it. And she wrote up this, I forgot what it's called, a proposal form stating like what she wants, like the benefits and blah blah blah. And she wrote down that she wants to be paid $50 an hour. And mind you, that office is very desperate for a hygienist, and they said yes. This girl is a new grad getting $50 an hour. Like, that's really good. So that's why I'm telling you guys not to settle for less, because there's so many offices out there that is willing to, you know, give even $50. There was one of my friends who's worked and offered her 45, and then, you know, after 3 months or something, they'll increase it. So one thing I forgot to tell you guys was that if you're looking for an office and you don't know what fits you, you basically kind of have to ask them like their philosophy or their morals and values. Like, if their morals and values doesn't align with yours, that's not the office you want to work for. With me, like I said, I don't think I could work for a production driven office, just because with me, I know that like dental insurance don't really necessarily understand why it's important to get like cleanings and this blah blah blah. Like, there's, you know, 3 months recalls, insurance only covers it once a year cleaning. My patient doesn't have enough money. It's almost like I want to give them a real good treatment, but with less, so they could spend less, if that makes sense. I don't really know how to like explain it the way I can see in my head. I'm not really good with explaining things. I've told you guys that several times, but I hope that makes sense. I don't want to curse, but for like a shitty job or a shitty office that's not going to pay you enough, and then they make you do all of these things that, you know, it's not even in your scope, and like expect you to like do everything for them.
No.
Also, there's going to be offices where they give you such like good salary but they treat you so bad.
No.
I wouldn't even want to work for, like, don't work for them, because you're just going to end up being so miserable, and you're going to rethink of, it's just going to make you have such a bad perspective on dentistry. One advice I also have when trying to look for an office that you don't know if you fit in or if you want to work for them or not is make sure during your work interviews or like shadowing or orientation is like you have to like pay attention on how their sterilization process works, because there's some offices that are actually kind of disgusting. They're unsanitary. Oh my god, I can't even, like, I don't even want to go that road. Just make sure that you work for an office that has good sterilization process and that's very clean. And you also want to work for, I already talked about this, but you want to work for a dentist that cares about their patients more than, you know, their money, because at the end of the day, we've all been there where, you know, like, you kind of don't have money for a treatment, and it's like an urgent treatment. You spend lots of money. That's where you're gonna learn a lot of things. If that dentist cares about patients, they will give you like a whole spiel on, you know, the type of diseases they see, or like personal experience. My dentist, like I said, you know, always like kind of scolded me. Not scolded, he didn't even yell at me. It's more like he was giving me knowledge about the patient that I didn't know that the patient had, which I should have. But like I said, it's all for experience. You're not going to know everything off the bat. But with dentists who cares about patients, they tend to have more, they tend to give you more knowledge about like oral diseases or like what they see in the mouth, and, you know, restoration types and stuff like that. Like, they're more willing to tell you about patients' like health, and you just get more experience from that type of dentist. And also, you want to look for a dentist that cares about their employees as well. Basically, as a hygienist, you're supposed to be the one who sees. You're not allowed to diagnose, but you're supposed to know everything, because once the dentist comes in at least in my office, once the dentist comes into your room and does the exam, you have to tell the dentist everything that you see. Sometimes they're only there for 10 minutes, max 15 minutes. You're with the patient for 45 minutes. You're with that patient longer than the dentist can see. So you're expected to not really do the dentist's job, but have to make them aware of what you want them to evaluate, or like in case like they miss something. They take out of their time to pause whatever treatment they're doing with another patient just to do an exam. They're kind of expecting you to know that person has something wrong with their mouth. And I mean, even though we're not allowed to diagnose, that's the reason why we went to school, is so that we can know if there is a diagnosis that the dentist should give the patient. The dentist highly relies on the hygienist to know these things, because we're with them longer. Like, we're with them for like the hour, and the dentist is only with a patient doing an exam for what, 10 minutes max. So it kind of makes sense. One thing that I do know is, I know in school, personally in my school, they always emphasize trying to document everything, because if you didn't document it, then it never happened. But with my office, that's kind of the same way with my dentist. Actually, that's one of the things I didn't do, was I didn't really document as much. It's better to over document than not. We have intraoral cameras. I'm not sure if every office have this, but they should. But with intraoral cameras, they're free of charge because they're just pictures. They're not like x-rays, and they're great because it's like your proof that this patient has this, or like proof that this patient has been seen for this type of lesion in our office, and we told them about it, and we educated that patient about it in case that patient ever decides not to get it treated. And like lawsuits and stuff like that in dentistry is big, so document everything and take intraoral photos of everything. Even if you think that's like something little, just take a photo of it, because it's not gonna hurt. The patient doesn't have to pay for it, so might as well just keep taking pictures. It's better to be safe than sorry. So, because this is my experience, every office is different. I don't know how other offices do it, but in my office, where I'm done with the patient and it's time for their dental exam, I had to directly go to my dentist and ask him, or tell him that room blah blah blah, whichever room I'm in, needs an exam. And we have this little like laminated papers that says room blah blah exam, so that you just give it to the doctor and he'll know like what room he needs to go to. There's some offices who they have that actual earpiece where it's kind of like a walkie-talkie, and like that's how they page the dentist or page each other. There's also the system in your computer system that has a chat where you can kind of type and like send a little message to like the dentist. My office, I have to directly go to him, physically walk there and give him that paper, or tell him, hey, blah 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 needs an exam, and then he'll come. But what I started doing was I bought sticky notes. It depends. There's 3 dentists in my office. 2 dentists that doesn't really care if I put the name or not, because they're gonna eventually have to see the name on the chart anyways. With my specific dentist who owns the practice, he likes me to tell him the name. So I started putting the name of the patient and then list out everything I want him to evaluate, or that I see that he needs to evaluate, or any suspected caries or lesions or any type of things. And then I also write down important things, like if this patient is a clencher or a grinder, if this patient has a complaint, anything. So I just put it on a sticky note, and then I hand the card. I stick it to the little laminated card, and I give it to the dentist, so that I don't have to waste time trying to tell the dentist what he needs to be looking for. And sometimes I kind of don't like saying,
oh, there's a cavity I see, blah, 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 in this number, in this tooth.
In front of the patient, at least the dentist will know which tooth I want him to look at. Patient doesn't get scared in case it's really not a big decay that needs to be treated right away. Dentists really do appreciate it if you kind of tell them in advance. Give them a whole spiel before they enter the patient's room, basically. Like I said, during my second day of work, I did an SRP already, and I actually want to give you guys some tips on how I do my SRPs, or what I find easier for me personally, and maybe it will work for you. Also, I actually have a day in the life of vlog SRP edition of my last video, so if you guys want to watch that, it's actually the previous video before this. It's not really a big advice, but I think starting with maxillary injections is better because it's less painful than giving an IA block on the mandibular. So if you start off with the maxillary, I feel like the patients are kind of at first when you see a needle, and dental needles are long. So whenever patients kind of see that, they kind of like, anticipate pain. So if you start off with the maxillary and they're anticipating this pain and it's not there, then they kind of calms them down, or it calms their nerves, or they become less anxious. But that's from my personal experience. So I always start off, if you are doing 2 quads that day, I would start off with the maxillary. Obviously if you do 1 quad and it's only the mandibular, then this advice doesn't pertain to you. With my work, we use Dentrix system. With Dentrix, they have templates like that you can click on the side to chart, but personally I kind of don't like using those templates. What I do is I make my own template. I put it on a sticky note app on the computer. I put my own template there. I put like, what I did on that appointment, services rendered, all that charting stuff basically, and I make my own template. So if you guys prefer having your own template or the way that you like to chart, you can do that. It doesn't really delete, it just stays there as a sticky note. You can save sticky notes on the computer. So if you guys want me to share with you my template, I can. Actually, this template I got this idea from the hygienist that I work with and the one that I shadowed for. She was such a big help with me. If it wasn't for her, I don't think I'd be as successful at work as I am right now, or like as comfortable. Let's just say that. But speaking of help, make sure that you also help your assistants and front desk. They're just as important. There's like no superior, like, yeah, just because I'm a hygienist and blah blah blah. Like, no. I hope you never have that mindset, because if anything, they're the ones who can help you succeed or help you like have a smoother appointments. Just be kind. Just be kind to everyone. Don't let titles get to you. They're just a title. Everyone's job is as important just as important, equally important for the patient. Without the front desk, no insurance for the patients that can be billed or something, or appointment stuff, or like if an assistant were to be running behind, or like you see them very like exhausted, because like sometimes they're like short staffed that day with the assistant, and one assistant is like for every room. Don't expect them to always like clean everything for you, and just try to help them. Yeah, it's their job, but if you're not doing anything, and if you can clean your own trays, if you have a cancellation and you see sterilization needs to be run through, or just do it. If they see that you help them out, they're more willing to help you out and as a hygienist. So I'm like very scared of trying to show the address because I don't want to leak information. But so this is the box of instruments that I received. That's also one thing. If you work for a dentist that cares about their employees, you get, not sure if every office does this, but my dentist definitely cares about their employees, so he gave me like my own set of instruments. There's actually a hygienist who I use her room, and she lets me use her instruments, so I don't really need my own instruments, but it would be nice to, and so that's why my dentist gave me my own set. I want to show you guys what I got actually. So if you guys want to screenshot, this is the list I gave my my dentist. You guys can screenshot it or something, but yeah, instruments are not cheap, okay? Even though they're just like this could be like $500. Well, overall this box is just thousands of dollars at this point. Also, when I first started, I always wondered, like, if you don't have downtime, when do you have time to freaking sharpen your instruments? Like, I always wondered that. Or obviously if you have cancellations and or no shows, that's when you can sharpen your instruments. But with me personally, even though I have no shows and cancellations, those are the times where I like to chart. Also, one thing I wanted to talk about, when I first started working, I don't think I really took a lunch time because I was having such a hard time with charting. I was a bit slow with charting just because I didn't want to chart something wrong, or or I didn't know what to put in. Now that I made that template, it was much easier. I'm starting to get kind of faster with it. If you don't finish your chartings on time by Thursday, you can come in earlier on Friday and just finish it. Just make sure you put in a little bit of notes, like keywords, to remind you what to document. But back to my instruments. So I asked my doctor to buy me like a hand mirror, but I didn't realize that I only asked him to buy me this, the handpiece part. And you actually have to buy the mirror and the probe separately. So buy something off of my list. Make sure, just know that the tip part for the mirror and the probe isn't part of it. But with mine, I didn't buy a universal curette because I cannot stand universal curettes. I don't know what it is. I'm more of an area specific gal. Favorite one has to be this, the S204 S9E2 by EverEdge, hue-friedy, this one. I love this instrument. I don't think I've used this instrument at school. We didn't have this instrument, but ever since I started using, I started borrowing instruments from other hygienists in my work because I don't have my own. They all have this, and I'm like, why did we never have this at school? Like this is so good. What I'm gonna do is I'm gonna put my little rings so that they know which one is mine. I do plan on updating you guys more. Do a year of working because obviously I learned so many things each time I work that I feel like a year from now I'm going to be such a different hygienist in a good way because obviously with experience. Oh my gosh, one advice I actually have. So before I end this video, I actually forgot to mention it. I don't know how I forgot this because this might be the most important one. You guys might work for a dentist and you'll see that you're running behind and the dentist has kind of been a little bit chatty and time is ticking and your next patient is already waiting for you, blah blah blah. So if you guys can, what I do at work from the hygienist I actually shadowed, she did this and I was like, wow, this is brilliant. But you guys might think it's like kind of common sense or whatever, but I didn't think of it because some people just have assigned rooms, okay? If there's an extra room or hygiene room in your office, put your next patient in that office and start them, and just so you're not behind. Start off your x-rays with that patient in that another room until your dentist is done with your previous patient or that patient is dismissed, so you can bring them, sterilize that room, blah blah blah. You can do your medical history, start your x-rays on that person. If you have an opportunity to do that, to use 2 rooms for your prophies, you can make your life easier just so you're not running behind. And also an assistant can sterilize your previous room and kind of bounce through each room. And with a dental room or any rooms, even if it's not a hygiene room, at least you can start off your patient just doing their medical history part, any signing forms or just x-rays. At least you can start that just so you're not super behind. Alright, so I'm just gonna finish the rest of my instruments, but I hope you guys enjoyed this video. Let me know if I missed some things or if you guys have any other questions about dental hygiene or even not about dental hygiene, anything. And I just realized it's been a whole year since my first upload on dental hygiene content, so that's exciting. I can't believe it. For everyone who has supported me, thank you so much from the bottom of my heart. I appreciate you guys. All the nice comments I've been getting, thank you guys. I love hearing from you guys. I know there's a lot of my subscribers that are in school or starting school soon, so good luck to you guys. I might shoot some content that's outside of dental hygiene that doesn't get a lot of views because I know you guys are here for dental hygiene, but if you guys want to support me, because I do love vlogging just in general. Thank you for watching and see you on my next video. Bye!